Hello, I wanted to begin this presentation off by apologizing with the quality. My laptop's not working very well, and my desktop here is not doing what I was hoping it would. And my microphone also decided to bite the dust, so here I am using my headphones as my mic. Um, the best way I can think of showing my teaching tool is by moving my computer here to show you my laptop. And my teaching tool is using a website called Prezi. Prezi is basically a glorified PowerPoint, and as you can tell, it's on smoking. Tobacco is a major contributor to cardiovascular disease, along with many other health-related illnesses. I'm going to kind of steer away from those other health-related illnesses and focus on my line of work, which is cardiovascular care. I developed an educational piece that uses visual and auditory aids to help educate those individuals in the community as to why they should reconsider smoking. This educational tool will demonstrate the damages that tobacco can do to the cardiovascular system and why it is important to quit. The target audience for this particular tool are those who smoke and abuse tobacco, particularly those who have been admitted to the hospital. The hospital does have a smoking cessation team, but from what I hear, they really don't provide a whole lot of visual or auditory tools. So this is kind of where I was hoping this would come into play. This teaching tool would also be nice if we can get it into the community to show the youth what damages can be done with the use of cigarettes and other tobacco products. Using an appropriate needs assessment, this tool doesn't really hit on the needs aspect, as I think the smoker must have their own motivation and will or desire to quit. Those people who do smoke uh, should have some sort of support system to kind of motivate them to quit. The only thing the educator can do is help identify the problem. Once the problem does become identified, the second portion, or readiness to learn, can be recognized. This hopefully occurs when the patient is in the hospital, because typically no one wants to be hospitalized, and one way to stay out of the hospital is to quit smoking or decrease your risk factors. Sometimes it does take a hospitalization for someone to realize that smoking is actually a problem and causing them harm. Once a patient is actually ready to learn, they must determine the appropriate learning style. This is kind of where this presentation I built comes into play. It bases the learning style on visual and auditory aids. There's a lot of cues in there which I think can be used by many individuals out there. I do have a couple of learning objectives I'd like to have these smokers follow. The first learning objective is to have the patient describe both long-term negative effects of smoking and focus on the positive short-term benefits of tobacco cessation following the video. This learning objective is a two-part objective that allows the healthcare team to realize that the presentation explains the risks of tobacco in a clear and concise manner. It also does show the benefits of smoking cessation. The second learning objective I'd like to focus on for the patient is to have them explain some of the physical effects that a cigarette can cause the cardiovascular system, and to have them explain how smoking cessation can prevent the disease from worsening. This objective will pertain to those who have had recent cardiovascular treatments or procedures. The healthcare team would clearly understand if the patient understood the information, if they were able to relate the objective to their own body. A good example is a patient who presents to the cath lab or even the hospital with a heart attack. To get them to educate the healthcare team as to why they should quit smoking, or if they would even say that their likelihood of another blockage forming would decrease by more than 50%, would show that they've learned and understood the damages smoking can do by using this teaching tool. If a patient who had a recent cardiovascular procedure is able to explain the damages smoking can do to the cardiovascular system, then the educational piece has provided a sufficient amount of information for the patient to understand. Some of the domains of learning, which are basically classified into three domains, are cognitive, affective, and psychomotor. The method I chose or would choose to help understand the information would be a combination of one-on-one instruction or self-instruction. I would love to see each patient learn on their own by using this visual tool, as I think it's accessible and easy for everyone to understand. But I also understand that some people may need assistance or guidance, and that's why I chose one-on-one instruction for those. I think the educational tool contains a lot of visual tools that are easy to follow and fun to watch. The affective domain is defined as the feeling domain and involves feelings, emotions, interests, beliefs, values, attitudes, and appreciations. This domain is difficult to overcome because many people are addicted to tobacco. They really don't want to envision themselves quitting because it's a pretty big struggle. And there are definitely withdrawal symptoms that are associated with cessation of smoking, and the fear of quitting can be pretty uncomfortable. Most individuals will develop a strong feeling or attitude as to why it is not a good time, and make up quite a few excuses as to why they should continue to smoke. The educational tool that I developed can allow those who use tobacco to understand that they are not the only ones out there struggling with this addiction. This tool will show graphic videos and images that can illustrate the damages that tobacco causes to the cardiovascular system. Hopefully these graphics and images can be enough to put some fear into the patient and provide rationale as to why they should quit. A group discussion could be formulated if the patient agrees to have family be part of the conversation or friends. Sometimes this group session could be enough to benefit and have the family encourage the patient to follow the path to smoking cessation. The third domain is called psychomotor, which is known as the skills domain, basically where the learner acquires fine gross motor skills and abilities. As domain does not particularly pertain to my educational tool because there are real no motor skills to follow up with, unless the patient's able to demonstrate how to use a nicotine patch or what dosages of nicotine gum are safe to use. The teaching strategies basically define the overall plan for a teaching learning experience that involves different methods of instruction to achieve the desired learning outcomes. I think the best combination of teaching strategies for this particular tool is the one-on-one or self-instruction tool. While group discussions would be ideal, the length of time associated with this group may be a little unrealistic for the smokers who would like to attend the class. I do think that if you force people to attend a class, there may be deterrence from smoking. So it's hard to suggest that this is the best teaching strategy. The educational piece that I developed will work in tangent with the other healthcare professionals teaching a patient regarding smoking cessation. This piece could just be the visual and auditory cues that can get a patient to understand what smoking does to the body, rather than just hearing a lecture from the physician and the team. I think that the appropriate learning environment in the hospital during the discharge should be during discharge instructions. I also think that this tool could be acceptable on the hospital's website, but also located on the televisions that are in every patient's room. Patients have a call bell that's also remote control, and the remote control has many options to choose different TV channels and learning resources, and this would probably be a beneficial thing to add to those learning resources throughout the hospital. The educational piece will probably take roughly 15 minutes or so to navigate, and it would summarize how dangerous tobacco truly is. It would also be beneficial to have the family or friends present, so it can kind of give everyone an overview on the damages tobacco causes. And it also can motivate those household members who also smoke to quit. few of the methods of evaluation of learning I would choose um, would basically start with using content evaluation to determine whether or not learners have acquired the knowledge behind my educational tool. Using some of the learning objectives could help identify whether or not the material is easy to follow or navigable. I would simply poll or ask random individuals who viewed the presentation if they understood the material and ask them to fill out an educational or an evaluation tool. The next method I would choose would be a summative evaluation to determine my educational, if it's appropriate, the educational tool. I would like to see if the individuals learned anything from my presentation by basically handing out a small brief quiz, um, and I would add up the results. I'd make sure that this would be very randomized and include many different cultures and backgrounds, so there's no bias towards this tool. And another method, the final method I'd like to use, is an impact evaluation to determine the relative effects of this educational tool on the instruction of the patient. I'd like to see and measure how many tobacco abusers have quit. I'd like to start by measuring a baseline before my tool's out there. I want to see how many people within the hospital have been readmitted and continue to smoke, and I'd like to compare months and months later after my tools rolled out into the smoking cessation course. I'd like to see if that number has changed. There are a couple barriers to teaching, such as those who truly do not care to quit smoking, or even the family member who refuses to quit. Typically, family members who refuse to quit don't help the patient who does need to quit. And the way to overcome this is trying to persuade them to quit smoking, or finding a different area to smoke away from the ex-smoker. I think the best approach is to try to be empathetic versus aggressive. I think we all have to understand that this truly is an addiction, and it's not something that someone can just quit today. Setting goals and rewarding these patients for their behavior, as well as acting interested, can also motivate them to lead to cessation of tobacco. A potential barrier or an obstacle that I found to learning could very well stem from education and or the ability to operate a television or a computer for an educational tool. We deal with a lot of the Amish here, and I wouldn't assume they'd understand how to use TVs and computers very well. So the way to overcome this obstacle is to find a way to print out the presentation into a pamphlet or brochure type form. We can also try to complete all teaching in the hospital if we can, where the technology is present. I'm going to quickly go over to the presentation on my laptop. Again, I apologize if the quality is not there. And I'm going to kind of scroll through it pretty quickly. And as you can see, my presentation here just basically is an infinite zoom. Zooms into and all the effects about the heart. We go into a video here which demonstrates what happens inside the blood vessel through every use of a cigarette, each individual cigarette there. And then if you keep on scrolling through, I have all sorts of statistics and data that revolve around smoking, along with a lot of pictures, associated with coronary artery disease and so forth. I can continue to talk this through. And basically each little cigarette butt that this goes up to has a different fact, what's inside of a cigarette, the different harms and substances and chemicals that go into this that people are ingesting every time they smoke a cigarette. Here's some general information on the nicotine and how it works, the effects that the nicotine has on the body. Nicotine contains carbon monoxide, which is one of the big gases that cause tons of damage to the blood vessels in the body. Quite a few effects here on carbon monoxide and the toxins combined here. There's a few more slides yet to come. Here's one that shows there are many people who still continue to smoke following surgery, and how it truly leads to more heart attacks and problems. And my final slide focuses on facts on why one should quit smoking, such as your life expectancy does increase. I do want to thank you for watching my presentation, and I hope this teaching tool does lead to more people wanting to quit smoking. Thank you.